There are serious funding concerns in the mental health sector. Frank Quinlan is the Chief Executive of Mental Health Australia. He joins us now from Parliament House. Frank, good morning to you. What indeed are these concerns?
The concern, Michael, is that we have a raft of programs, some possibly $300 million worth of programs that are due to end on June the 30th. And these are mental health programs that very vulnerable Australians depend on, often for their day-to-day support. And we don't know the future of those programs come the 1st of July. And our concern is really that this is no way to run a mental health system, that these services are important to people in the community, and yet time is ticking, and we fear that without some certainty around these programs, people who need them will be affected directly.
That's an awful amount of money, $300 million. Why is there this uncertainty in the first place?
Look, I've described it as a sort of perfect storm of uncertainty. At the moment, we have a few things happening all at once. The government commissioned a review of mental health services and programs nationally when they came to government, and we think that's an important review, and we've supported that review. It reported to the government on November 30th last year, and no doubt they're considering their response to that review. At the same time, we have the rollout of the National Disability Insurance Scheme affecting many of the programs that have previously been provided by the Department of Health. They're now touching upon that scheme. We also have simultaneously a re-tendering of services for Medicare locals that often delivered mental health services to people directly in the community. And at the same time as all of this is happening, we've had a new minister take on the portfolio, and a new minister who's had some pretty big issues to deal with in that portfolio. So we think it's a combination of all of these things that's meant that mental health has really been left pretty close to the brink.
Close to the brink, and of course this will be devastating news to the people who rely on these services out there in the community. But also, what does it say, what pressure is this having on the staff, Frank, who now have this axe potentially hovering over their head, many of whom are already overworked and under a lot of stress themselves?
That's right, and delivering very difficult services. The concern is that they're a very skilled workforce, and the fear is that as people face uncertainty in their jobs, they start to make other plans and start to take up positions in other roles that provide them with greater certainty. We know on all the projections that we actually need to extend our mental health workforce, not to reduce it. And so we're eager to see the Prime Minister today take action to ensure more certainty across these programs. I don't think there's any debate that these are essential sorts of services that are going to be required into the future. No one's questioning that we have too many mental health services. The real problem seems to be the red tape and the cumbersome nature of funding these services on a 12-month by 12-month basis.
OK, Frank Quinlan at Parliament House, thank you very much for your time this morning.